Choosing between housing and health care, it's a scenario more people are facing as rents in the city continue to climb.
But there are some solutions that could help families facing this very real dilemma.
I was in the hospital every 3 or 4 months.
A bulging disc in Shannon Bays' back and severe arthritis limit his ability to work.
It's been hard.
I know the trade-offs. I've heard them every day. You know, people are either paying their rent or they're paying their health care.
Julie Porter is president of the Housing Partnership. She's not surprised by a new study showing a lack of affordable housing drives down health and keeps North Carolinians in poverty.
These are working families, and they cannot afford to live in Charlotte, period.
Even with his wife working 2 jobs, Bays says rent increases are taking up most of the budget.
If you're spending it on housing, you're not spending it on quality food. You're not spending it on your medications. You're not spending it on going to the clinic.
Dr. Don Jonas runs CareRing, a nonprofit organization dedicated to providing health services for those lacking access.
You have to really look holistically. And clearly having affordable housing is essential to a family being able to get ahead in this economy.
CareRing's home visiting program for first-time mothers takes housing into account.
But one of the key things that they do during that visit to the home is to assess the conditions, to look and see, is the carpet moldy? Are there actually couches that are usable? Is it safe for little ones to be within that home?
Homes in disrepair often lead to even more health problems, respiratory issues from mold, moisture, asbestos, or lead paint, pest control problems, accidents, and falls.
People end up in the emergency room, which costs them a whole lot more money than it would to just get them stable, permanent, affordable housing.
There are an estimated 13,000 people in Mecklenburg County without any health insurance at all. Dr. Jonas says the healthcare industry is finally realizing the connection between healthcare and housing.
You're going to start seeing that there are federal Medicaid dollars, traditionally just tied to clinical care, that can actually be utilized to provide appropriate housing.
The Medicaid changes Dr. Jonas mentioned should go into effect in December. WCNC is committed to following the affordable housing crisis here in the Queen City for a year.
You can watch all of our stories along with our collaborative partners at charlottejournalism.org.
Thank you for joining us. Good night.